Good afternoon, and thank you all for listening and as we continue to update Islanders on the COVID-19 situation. Today, I am confirming that our second case of COVID-19 was in Prince Edward Island. The patient is a man in his 40s in Queens County. He returned from travel from the United Kingdom and self-isolated because he knew he was supposed to do so immediately upon returning home. He called 811 and was tested on Monday, March the 16th, and his results came back later last evening. I spoke directly to him, and I'm so pleased he's doing well at home, and he had mild symptoms. It is a really good example of why we need to self-isolate and the importance of self-isolation. If he had not self-isolated, he may have inadvertently infected others in the community. So it is a reminder to those who are self-isolating after return from travel, it is really important to do so. In terms of the numbers of tests, because we've gotten a number of questions about this, there have been a total of 213 tests completed as of approximately 9 o'clock this morning, and we received a number of tests back last evening, so a total of 122 negative tests and our 2 positive cases to date. A couple of updates that I think are important to mention. That we have a self-assessment tool online, which will help with our 811 calls. So it may be a tool that people can use to find out if they need to call 811 and consider being tested. And it's being used in a number of other places, and we are going to have that available online today. The other thing to continue to mention, and I know we've talked about it different times before, but I'm encouraging Islanders to stay home and only go out for essential reasons. Ask ourselves each time we go, do we really need to go? But yet it's important that we stay connected while we stay distanced. And I know Islanders are coming up with many creative ways to keep connected and keep busy. And whether they are online workouts, painting classes for children, music performances online, sharing artwork, and learning resources, I think it's all really important. I know our grocery stores, some are offering an extra time, especially for the elderly and most vulnerable. And there are deliveries being made for our friends and neighbors. So I continue to encourage that. We've talked about essential versus non-essential services. And online, as of this morning, there is a much clearer outline of what is essential versus non-essential in terms of the businesses and the categories. And I think that may be helpful for people to understand what is considered essential and non-essential. And, you know, in that part of that discussion, I think I was not clear yesterday, and that was, and I am sorry about that. In trying to protect Islanders and the staff who work at liquor stores, I think we need to talk about what my intention was. I've worked with many Islanders with alcohol use disorder, and we recognize that alcohol use disorder, alcoholism, impacts many families on PEI. And alcohol withdrawal is a danger, so we would never leave Islanders without access to alcohol for their own health for certain people. So I think what I was not clear about yesterday is that the stores, liquor stores, will close for in-store shopping of liquor this afternoon at 2 o'clock, but the details around other access will be made available so that whether it's pickup, delivery, drive-through. Those are the options that are being explored for and will be announced after by the end of the day today. The other thing to remember, those are government-owned and operated liquor stores that we're talking about, but the agency stores and the breweries will remain open. So I think it's important to keep that in mind, and as we go forward. And I'm sorry I was not as clear as I should have been, and I know it created an issue yesterday afternoon that was really unintended. We all live here, and this is hard on all of us, these decisions that we're making. But it is our chance to get it right, because if we make the decisions we need to make now, it will influence what happens in the weeks and months ahead. If we look at what we know about this coronavirus and the mortality rate, if that was to happen in PEI, there would be 3,000 deaths. And it reinforces to me why we need to make these kind of measures that we're taking here in PEI as well as around the country. The choices we make today will have a major impact on our provinces for all of us in the weeks and months ahead. And again, this is not easy. This is hard. It's hard for me. It's hard for our families. It's hard for our businesses. It's hard for government. But I really encourage Islanders, not just encourage, I'm asking Islanders to have understanding, respect the self-isolation, respect the social distancing, and do everything we can together to make sure that we don't have the impacts that they're seeing in Italy and other places in the world. So I'll turn it over to Marion for some questions, or for some comments around Health PEI.
Thank you. Health PEI continues to work in all respects with limiting the spread of the COVID-19 and ensure we offer services that are safe and high quality care. And we can, from our side at Health PEI and offering the health services, particular our acute and critical care services, we really appreciate the difficult decisions that Dr. Morrison and her office and the government have taken to try and limit the spread of this virus, because it is going to help us manage any of the potential cases that come forward. We have moved to an essential services only to maximize our capacity to provide those services and to prepare for an increase in patients related to the pandemic, should we see that here. We're working closely with the Chief Public Health Office on our protocols and practices to ensure the safety of our staff and patients as we move this forward. As of yesterday evening, we've increased our visitor restrictions. That means no visitors to Health PEI facilities. We've developed exceptions and compassionate protocols in place for urgent and compassionate reasons, such as critical care, neonatal care, end-of-life, pediatrics or obstetrics situations. So we'll be working with families around those scenarios to make sure that people have access to visiting their loved ones. We continue to look at our supplies and our equipment, including ventilators, and we get some questions on this, so I just want to speak a little bit about this as I did the other day. We currently have 19 ventilators within Health PEI in our facilities that are ready for use. We are also working closely with our vendor to purchase additional ventilators beyond a national request that went forward for an additional 15 ventilators through their process. I think it's important to note for Islanders, though, that during our even regular operations and not essential services, Health PEI maintains an increased capacity for 4 or 5 times what we normally have in place for ventilator services. So even if we were running our regular operations, we would have the capacity for ventilator services for Islanders if they were needed beyond and above what we normally need. So we'll continue to update as we find more information around increased equipment. For supplies, we do want to say that we need to continue to manage and conserve our supply of personal protective equipment closely, and we're doing this daily. We have enough swabs and protective equipment to support the current needs for screening and testing. So we're conserving our supplies to make sure that our essential services and our staff and patients are protected to be able to offer those services. I also want to just say that essential services are continuing, and Islanders do have access to services like dialysis, like chemotherapy, like emergency and critical care for stroke or heart attacks, and those things are still in place. So please continue to access those services, and if you have questions about the service that you may be requiring, please call ahead regarding your appointment.
OK. Bon après-midi. Je vais commencer en français. Je vous confirme aujourd'hui qu'il y a un deuxième cas positif de COVID à Lille. C'est un homme et il a environ 40 ans. Il habite à la région Queens County. Il est revenu du Royaume-Uni et s'est auto-isolé immédiatement quand il est revenu. Je lui ai appelé hier soir et heureusement, il va bien chez lui. Il a des symptômes légers. À la fin de la journée hier, 213 tests ce matin, il y avait 213 tests avaient été réalisés à l'île du Prince-Édouard. Il y a maintenant les 2 cas confirmés de COVID-19 à l'île du Prince-Édouard. Et il y a 122 tests négatifs ont été confirmés. Ce nouveau cas est un exemple parfait de l'importance de l'auto-isolement. Parce qu'il s'est auto-isolé, il n'a pas infecté la communauté par mégarde. Si vous vous êtes auto-isolé pendant 2 semaines, vous devriez rester chez vous. Je continue de recommander fortement que les insulaires restent à la maison autant que possible. Posez-vous la question, avez-vous vraiment besoin d'y aller? C'est critique que nous restions connectés les uns les autres, mais en gardant une distance. Comme plusieurs de vous, nous voyons comment la créativité des insulaires pour s'appuyer les uns et les autres. Par exemple, les cours d'art en ligne, les tutoriels en ligne pour rester actifs, les musiciens qui nous offrent des performances, des ressources académiques. Les livraisons à domicile pour s'aider. Il y a toutes sortes de choses qu'on fait à ce moment pour aider les uns les autres. Et je veux clarifier, parce qu'hier, je n'étais pas claire. Nous avons annoncé hier que tous les magasins de cannabis ferment aujourd'hui à 14 heures et c'est vrai. Mais c'est aussi important pour les magasins d'alcool de clarifier, c'est seulement pour les magasins que le gouvernement opère. Mais les magasins de franchise restent ouverts. Et je reconnais l'importance de ces produits, sont essentiels pour certaines personnes. Et nous devons nous assurer qu'il existe des moyens d'accéder à ces produits pour ces individus. Alors, et puis c'était toujours le cas, mais ce n'était pas clair. Plus tard cet après-midi, on va avoir les détails pour comment on peut faire en plus des magasins de franchise et des brasseries, nous avons, il faut respecter l'éloignement social, mais on cherche les détails à propos de la livraison à domicile ou des options pour l'accès. Mais il y aura l'accès quand même. C'est notre moment maintenant de faire les choses comme il faut. Les insulaires, c'est important qu'on suive les conseils pour protéger nous-mêmes et les autres. Nous savons que si nous ne faisons pas ce qui est nécessaire, nous risquons une situation comme l'Italie. Nous pourrions être dans une situation où des milliers d'insulaires seront affectés. Le taux de mortalité de COVID-19 est à peu près 2%. C'est environ 3000 insulaires. Faire les choses comme il faut maintenant, ça veut dire réduire le nombre d'hospitalisations et de morts dans le futur. C'est vraiment la meilleure façon qu'on peut prendre soin de l'un et de l'autre. Les choix qu'on fait aujourd'hui, moi, toi, les gouvernements, les communautés, auront un impact majeur et direct sur notre province dans les prochaines semaines et mois. Je sais que c'est difficile pour nous, pour tout le monde. Et on doit faire comme il faut. Merci.
Dr. Morrison, I'm wondering if you can elaborate a bit on that 3,000 figure, because obviously that's going to scare a lot of people. Are you doing the math based on a 2% death rate? Because we're hearing some reports that it could be 4%, which obviously doubles those numbers. So can you explain a little bit what that 3,000 figure means? And obviously, is that something that we should be bracing for?
Well, I raise that because I want to emphasize the importance of following this guidance. And I think when we have 2 cases only, the question is, why are we having such huge public health measures in place when we only have a couple of cases? So it's based on the percentage of what has been seen to be the mortality rate associated with this illness. But yes, you're right, Wayne, it can vary. But it's and the point is not so much the number, but it's about emphasizing how important it is that if we try to do this right now, it will make a difference. And I think we are. I think this is why we're here. This is why we're here every day trying to make the best decisions we can to minimize the impact of this pandemic. And I think we're going to get this right. And so it's really the calculating out the percentage is to reinforce the message of why we are doing these kind of measures. It's not, and we're doing these kind of measures knowing that they have unintended impacts for all of us. But that's why we need to weigh that out with the potential that we can really make a difference here.
I also want to ask you, if I can, about frontline workers, but I'm not talking about healthcare workers. I'm talking about those who are at Sobeys and Superstore. These are people, many, who are making minimum wage, who are really unable to keep that safe 6-foot distance from their customers. Should they be, I guess, 2-part question, how do they protect themselves? Should they be wearing masks? Should they be wearing gloves? And how can we as customers help protect them when we're going into this essential service?
Yes, and I think all the businesses are looking and trying to figure that out, Wayne, to try to be able to protect their staff and the public as well. So, for instance, we have reached out to the grocery store chains to talk to them about making sure that there's appropriate hand washing stations in when you go into the grocery stores, and I think that's really important. We're asking, instead of bringing a whole family to the grocery store, that one person goes to the grocery store. They shouldn't go to the grocery store if they're sick or have symptoms, and that's to protect other people that may be in the grocery store, but also staff. In terms of, and I think a lot of businesses are trying to figure out ways that they can, as best as possible, doing tap options, not handling cash in the same way. And so it's going to be a little different, and it may look different in every business. So we're trying to give the best advice, and yet we still need to have certain essential services available. So it's a process, and we're all learning every day. We're getting into the granular details of different situations, and we're going to try to figure it out together. And certainly there's questions coming in to us that are things we may not have thought about, but we'll try to figure it out together and work with businesses certainly to see what are the best options.
Stu Neatby from The Guardian. I just had a question about testing and how proactive the process is. At this point, is all the testing through self-reported cases through 811, or are there specific targeted groups that the province is sort of focused on more proactive testing on? Like you mentioned, travelers, obviously.
So the screening tool that's been used in some variation across the country has been focused on returning travelers in the last 14 days who have symptoms, a cough, a fever, shortness of breath, not feeling well, variation. So we've been doing that because the majority of cases in this country are related to travel outside the country. Now, the other area that, and we've been talking to the lab about this as well, that are being tested are patients who may be admitted to hospital with influenza-like illness, so respiratory type illnesses, will be tested for COVID-19 going forward, so that we will, and that's with or without a travel history, just to make sure that we're capturing some of that. So it's and of course, Stu, that may change. That criteria may change. At this point in time, I'm certainly trying to make sure that we test the people who do have symptoms related to travel, and I think the more we test, the more we can have early identification and self-isolate. And we're still at a different point in this pandemic than maybe some of the other provinces who've had more cases. But we'll continue to monitor that going forward, and whether those criteria need to change. We'll be following national recommendations, but also our local epidemiology.
And can you talk a little bit more about the gentleman you mentioned earlier who was in the UK? Was there a time period between when he returned to the island and was tested? Is there any sort of tracing of, where he might have actually come in contact with the virus overseas?
Yeah. So he flew home last week, and he went immediately from the airport to his home, and then a few days later, with mild symptoms, he called 811, and then was brought in for testing using all the precautions, and he self-isolated then pending the test results. He, as part of our contact tracing, it's a normal discussion and quite detailed discussion of who he may have been in contact with, and when he had symptoms, and when they started. He did not have symptoms on the plane, and he's done absolutely everything that we would want someone to do, but any contacts he's had are being followed up.
And that includes people who were on his flight?
No, because he did not have symptoms at that time. But if that changes, certainly they would be advised of the details. But he did not have symptoms on the plane, either on the international or domestic flight, and that would not involve the contact follow-up at this point.
I do have a question for Mary, and can we get that in now, or do we want to get the Dr. Morrison questions done first?
I'm not sure. Marion's right here, so it's.
Well, maybe I should say it could be either one. What I to figure out, we're hearing reports about in terms of doctors' offices, walk-in clinics, people having difficult times getting through. Do we have any sense? I know, Marion, you addressed that health PEI is still available for critical services like emergency, but are doctors still seeing patients? If someone is sick with something other than COVID-19, how are they accessing the healthcare system today?
There are some guidelines in addition to what we have put in place. So as far as I know, there are still physicians seeing and nurse practitioners seeing clients in the community. But we're trying to put out some more guidance for them so that they are comfortable with seeing what we have in our community. Patients who have no relationship with self-isolation or suspected of having COVID-19 or being screened. So we're just working with those individuals and physicians and nurse practitioners around what access there is. So that's why I mentioned for people to call ahead if they're wondering about their appointment. But I do know this week family physicians and others have been continuing to offer services, and some specialist physicians as well, to their patients. But there have been some individual decisions made around that with respect to their staffing in their offices and some of those things. So we're working with the Chief Public Health Office on getting some guidance more clear for them on how to make sure those services are continued to be offered.
Question en français, questions in French.
Oui, Julien Lecacheur, Radio-Canada. Docteur Morrison, est-ce que vous pouvez détailler exactement le parcours de ce monsieur âgé dans la quarantaine? Il était au Royaume-Uni. Sait-on la date de son retour? Est-ce qu'il a volé depuis Londres à Toronto, puis Toronto à Charlottetown? Est-ce qu'on connaît les avions, la date de son retour? Parlez-nous de son parcours au complet, s'il vous plaît.
Ah oui, et puis vous êtes correct, il est revenu du Royaume-Uni, c'est la semaine passée. Je ne parle pas de la date spécifique, mais il s'est auto-isolé immédiatement quand il est revenu. Il est allé chez lui de l'aéroport. Il n'a pas eu de symptômes sur les vols, et c'est après qu'il est arrivé chez lui qu'il a eu les symptômes. Et puis il a appelé 811 juste comme il faut. Et alors on est tellement content qu'il a fait ça. Et puis, mais c'est normal pour chaque cas. On demande les détails à propos de les symptômes, le temps et les contacts. Et on va, s'il y a quelque chose nouveau, on va annoncer ça.
Pourquoi avez-vous parlé du 16 mars? À quoi correspond la date du 16 mars pour ce monsieur?
C'était parce que j'ai eu beaucoup de questions de quelle est la date de test et puis combien de temps qu'il faut attendre pour les résultats. Et pour lui, alors, c'est pas vraiment un détail tellement important, sauf qu'on on savait qu'on attendait plusieurs résultats hier. Alors, il était un des résultats qu'on attendait, mais il y en avait plusieurs résultats négatifs qu'on a eu hier soir. Et puis, ce monsieur qui était le cas positif.
Juste pour terminer, à quel point le comportement de ce monsieur de s'auto-isoler est un exemple parfait pour vous de ce que vous demandez aux insulaires?
Parce que il savait c'était de auto-isoler était qu'est-ce qu'on voulait qu'il fasse. Il a fait exactement ça parce qu'il est revenu chez lui et puis il a appelé 811 avec les symptômes, il est testé et puis pour faire ça, il a c'était un exemple où il n'a pas infecté la communauté par mégarde. Et je pense que c'est un bon exemple pour les autres qui retournent d'ailleurs hors du pays pour en faire aussi.
Dr. Morrison,
in English?
Yeah, Sean McDowell for the Eastern Graphic. For yourself, Dr. Morrison, has there been further talks of rural testing sites or mobile testing for islanders that otherwise can't make it to Charlottetown or Summerside?
Yes, so a couple of things. I think the conversation continues, and some of it will be based on demand. They are actually exploring, and we may be able to have details in the next day or two about a drive. If you go through 811 and need testing, that drive through testing as opposed to going into a building may be an option. Also community paramedics being able to go to do testing in someone's home if they cannot get out to have the testing done. So I think at this point in time, as opposed to a certain site, if any of those issues come up, we'll be making sure people who need to be tested, and if they can't get to the testing site, we'll try to make sure they're tested.
Okay. I just had a couple questions for Marion Dowling. You mentioned that the province has 19 ventilators ready to go and that you're looking to purchase more through a supplier. Has the supplier given any indication of what the shipping time is like for those ventilators? Is there a backlog or anything?
We haven't received specific information on an exact delivery date, but we understand that they do have some that could be made available to us soon. And potentially sooner than the national order could be available to us. So that's why we're also exploring that option. But I don't have specific dates from the vendor yet.
Okay. And now with regards to the 19 ventilators we already do have, what's the split of the ventilators between the hospitals? Is there many in rural hospitals such as Western Hospital or Kings County Memorial?
Good question. The ventilators are both related to our 2 intensive care units on the island. So 15 of them are at the Queen Elizabeth Hospital, and they're divided up with 10 related to the ICU. There are several transport ventilators that we use for critical care patients if they need to be transported off island that can be used, as well as 2 neonatal ventilators which are attached to the neonatal intensive care unit at the QEH. And there are 4 ventilators at the Prince County Hospital within their intensive care unit. And that's really the environment that those machines are used.
Dr. Morrison, Laurent Rigaud pour la Voix acadienne. J'ai une question concernant le chiffre de 3000 morts que vous avez annoncé un petit peu plus tôt. Vous avez expliqué que c'était en tenant compte d'un taux de mortalité de 2% sur l'ensemble de la population. Est-ce que c'est un chiffre qui est raisonnable ou exagéré, ou est-ce que vous essayez de faire comprendre aux insulaires que ça peut être très très grave s'ils ne font rien?
C'est un nombre juste pour essayer de comprendre les gens que c'est grave et qu'il faut faire attention et puis essayer de comprendre les décisions qu'on fait ici vont faire une différence. Et c'est pas toujours facile de comprendre pourquoi on fait des décisions maintenant quand il y a seulement 2 cas, mais c'est les décisions qu'on fait aujourd'hui, les choix qu'on fait aujourd'hui qui vont impacter ce nombre. Et alors, c'est juste pour qu'on encourage, c'est plus d'encourager, mais qu'on s'assure que les gens sachent si on fait rien, ça va être tellement pire.
Et juste une question au sujet des personnes qui sont obligées de travailler comme les livreurs ou les caissiers ou les caissières dans les supermarchés. On voit aujourd'hui que les livraisons, que ce soit Amazon ou autres, elles augmentent parce que les gens sont chez eux et ils se font livrer beaucoup de choses. Pensez-vous qu'il faille limiter ces livraisons pour protéger ces personnes-là qui, elles, n'ont pas le choix d'arrêter de travailler?
Oui, c'est difficile et beaucoup de questions là-dessus. Je pense que les business, les employeurs cherchent des manières de protéger leurs employés et puis on continue de les supporter et aussi de protéger les gens qui achètent les choses au magasin, mais aussi on doit travailler avec les employeurs pour les aider à penser d'autres manières de protéger les employés.
Dr. Morrison, it's Wayne Toto at CBC. Can you just clarify, because my email and social media is lighting up, can we give any more details on the airline flight number and the airport that this individual flew into on Monday, March 16th?
So if the gentleman had any symptoms related to the flight, and as you know, we announced another flight where someone may have had mild symptoms on the flight, the previous case, we will do the same thing if there's any need for the public to be concerned at all. And I would be concerned too. So as soon as, if there's any need to do so, we also need to respect the privacy and the confidentiality of this case as much as possible. And so I will be the first one concerned, and along with anyone who may have been on a flight with anyone who has any concerns. So all those travelers may have been coming home with a lot of other travelers who have a need to self-isolate. So anyone who is returning from travel, it just reminds us to self-isolate for 14 days. And if there's any concern about any symptoms on a flight, and that's consistent with what is being announced as well at this point in time. And if anything changes, Wayne will absolutely be giving the details of the flight.
Thank you very much. And just my last question, if you have time, is with regards to maybe a question no one can answer, but based on what we're seeing in other jurisdictions, do we have any sense how long these restrictions will remain in place? How long are we going to have to do battle? Are we talking a few weeks? Are we talking a few months? Do we know the answer to that question?
I don't know the answer to that question, but I think what we do know is all the advice that we're seeing around the world is we need to act now. We need to do it quickly and put these measures in place, because if we do it well now and do it quickly, it will shorten the time for us to have these measures in place.
Thank you very much for your time.
Okay. Thanks, Wayne, and others.